We are live now, Doctor.
Okay. So, good evening, friends, and welcome to this second quarter final of season 5 of Big Q. Well, this is a pan India intercollegiate quiz which is hosted by Brain Teasers in association with Ophthalmological Society of Nagpur, and it's the Big Q. And here is the
आठ समंदर अपना
tune of
अंबर
the
खोज ले अब तू
last five
अपने दम पर
seasons.
फूक मार के धूल झाड़ ले छोड़ छाड़ के सारे छप्पर आठ समंदर अपना अंबर खोज ले अब तू अपने दम पर फूक मार के धूल झाड़ ले छोड़ छाड़ के सारे छप्पर खोल दे पर खोल दे पर खोल दे पर खोल दे पर बंद घड़ी की भी रुकी हुई सुई होती सही दो दफा चुप क्यों है रहना मन का तू कहना रोके चाहे हिचकियां खोल दे पर खोल दे पर खोल दे पर
So, friends, it's just not science, but it is some adrenaline rush with games and some excitement. So, once more, good evening, friends, and my pranam to all the mentors and the big Q, our quiz masters. Well, Brain Teaser team welcomes you to this second quarter final of the fifth season of Big Q. For the people who are novice and have joined recently, well, Brain Teaser is an online platform for hosting quiz for ophthalmologists of our country since last 6 seasons. And it was about 4 years back for the first time we initiated an exclusive quiz for postgraduates of our country with a single aim of getting all postgraduates from across the country on a single platform. With more than 320 institutions offering ophthalmology, well, this season, we have more than 220 teams which participated in preliminary rounds, and we are very buoyed by the amount of participation which we are seeing. Team Brain Teaser team is indeed thankful to Ophthalmological Society of Nagpur who have been associated with us for last 2 or 3 seasons. My sincere most thanks to the President, Dr. Rahul Tiwari of Ophthalmological Society of Nagpur for associating with Big Q. Well, this fifth season at 6 preliminary rounds, there would be 4 quarterfinals, 2 semifinals. Well, this is the second quarterfinal, 2 semifinals, and then the final, one final. Well, these episodes of quarterfinals are being aired on consecutive Wednesdays at 7:30 p.m. So this is second. So third and fourth would be on the consecutive Friday, Wednesdays of the month. Brain Teaser team is extremely thankful to the team of Quizmaster who really toil hard to create such a wonderful experience of learning with fun. We are indebted to them for all the efforts they take for all this. Well, today's episode, we have Dr. Neha Desai, who is working as an assistant professor in retina unit at MNJ Western Regional Institute of Ophthalmology, Ahmedabad. Thank you, Dr. Neha. Dr. Shruti S, who is a glaucoma consultant at Narayan Netralaya, Bangalore. Welcome, Dr. Shruti, and thank you. And Dr. V. Mahati, who is a consultant and head at Department of Pediatric Ophthalmology and Strabismus at Sankarai Hospital, Guntur. Thank you once more, Mahati, for joining us as a quiz master. Well, we had Dr. Vijay previously, and you are welcome. And this is your first episode. We are indeed thankful to you for joining us again. No program is possible without a strong financial support from pharma industry. We are indebted to His Highness team who have been partnering with us since last 2 seasons. And my gratitude goes to Mr. Suryanarayan and Mr. Naresh and Mr. Kaustubh. And of course, to the whole field force of His Highness who have made such an effort to enroll the postgraduates from across the countries, from the most of the, even from the most peripheral colleges. Thankful to thankful to Numerotech and team headed by Mr. Sai for smooth and flawless execution of Brain Teaser platform because all registrations, live quizzing, computing results, all backend work which you see smoothly is being done by this team. Thank you, Sai, and your team. And of course, last but not the least, my co-host, Dr. Shilpi Narnavre, who is an avid quiz master as well as a vitreoretinal surgeon at Sarakshi Nethralaya, for sharing this responsibility along with me. So now over to you, Dr. Shilpi, for familiarizing the participants with the rules of the game.
Thank you, sir.
So, welcome back, friends. I hope all have joined. So, let's quickly see what are the rules of the quarterfinals. So, yes. So, there are total 4 quarterfinals. 84 teams will play, 21 teams per quarterfinal. And today is the second quarterfinal. Third quarterfinal will be on the next Wednesday, that is 8th of April at same time. For teams, you have to log in from two devices, that is Kahoot and Zoom platform. First screen is a live quizzing on the Zoom platform, and the second will this out of this that you will face the one round face to face, and it is only for the teams, not for the private practitioners. While the second screen is the Kahoot for the MCQ round, which is played by both the audience and the teams. I request all the mentors to log in from separate screen only on the Zoom platform. From today's episode, 5 teams will qualify for the semi-finals, and the criteria for qualifying is your marks of today's quarterfinal plus the total of the best 4 preliminary rounds you had played. So format will be, we'll have MCQ. So we'll have 3 sets of MCQs. Each set will have 5 questions, which is played by both the audience and the teams. There will be no negative marking in this, and you will get 10 seconds time for per question. Now, the other round will be the rapid fire round for the teams only, in which each team will face one of the quiz master, and they will have to answer 5 questions in 30 seconds time. Remember, there is negative marking in this round. So for every correct response, you will get plus 10. For incorrect, -5 will be deducted. But if you pass the question, no marks will be allotted or deducted. And remember, you will have a time of 30 seconds only. So if you don't know the answer, just pass on. You can answer the question later on if the time permits. Teams who are not playing today's quarterfinal, they can play as an audience in the private practitioner category. So these are the prizes for the postgraduates in the finals, while we have audience prizes per episode. So with this, I invite our first quizmaster, Dr. Neha Desai. She is working as an assistant professor in retina unit at MNJ Western Regional Institute of Ophthalmology, Ahmedabad since 2009. She is the principal investigator and co-investigator in various clinical trials of ARMD and diabetic retinopathy, and she is passionate for teaching medical and surgical retina to senior residents and fellows. With this, I hand over the screen to Dr. Neha Desai. Welcome, ma'am.
Thank you, Shilpi madam, and all the very best to all the participants.
Shall we start, ma'am?
Yes. MCQ 1 is a 60-year-old patient presented with visual decline since 3 days after uncomplicated phacoemulsification. Slit lamp examination shows localized corneal edema superiorly near the main incision. What is the most appropriate management? A. Topical hypertonic saline and observation. B. Immediate intracameral air or gas desmetopexy. C. Penetrating keratoplasty. And D. NDR membranotomy.
Ma'am, shall we start the timer?
Yes. And the answer is immediate intracameral air or gas desmetopexy. A post-cataract surgery desmet membrane detachment with significant separation rarely reattaches spontaneously. So desmetopexy with air or long-acting gas such as SF6 or C3F8 is the treatment of choice. Question 2 is the condition in the limbs is classified as which of the following? A. Corystoma. B. Teratoma. C. Hematoma. D. Adenoma. Your time starts now. The answer is A. Corystoma. The choristomas are normal tissue that is skin, hair follicle, or fat in abnormal location. Now, next question is the complication associated with this condition include all except A. Iritis, B. POAG, C. Pigment dispersion, D. Focal cataract. Your time starts now.
Team Vision Walkers, please unmute yourself. Please mute yourself.
And the answer is B. POAG. The above condition shown in the image is a iris cyst. So it leads to angle closure glaucoma, corneal edema, lens subluxation, plateau iris, and focal cataract. Next question. The most common intraoperative risk in pseudoexfoliation cataract surgery is A. Wound leak, B. Zonular dialysis, C. Choroidal hemorrhage, D. Retinal detachment. Your time starts now. Answer is B. Zonular dialysis. Mechanical weakening and direct damage to the zonules is caused by deposition of pseudoexfoliative material on the zonules. The next question is the eye condition least likely to be associated with aqueous misdirection syndrome is A. Myopia, B. Hypermetropia, C. Nanophthalmus, and D. Angle closure glaucoma. Your time starts now. Answer is A. Myopia. The small hypermetropic eyes with angle closure glaucoma are more likely to develop aqueous misdirection syndrome after laser iridotomy or filtering surgery. The aqueous misdirection syndrome is also known as malignant glaucoma. The normal flow of aqueous is blocked at the level of ciliary body, lens, or anterior vitreous space, causing misdirection of aqueous humor to the vitreous. In presence of patent iridotomy and the angular pressure is very high.
Ma'am, you need to introduce Dr. Shruti.
Now I would like to invite Dr. Shruti Madam for the. Yes, madam. Dr. Shruti Madam is a glaucoma consultant at Narayan Netralaya, Bangalore. She has completed MBBS from VIMS Bellary and completed DNB and fellowship. She was awarded Best Paper in Glaucoma Session at COSCON 2017, awarded Best E-Poster in Glaucoma Society of India Conference in 2018, presented a poster in World Glaucoma Congress Melbourne in 2019, awarded FAICO in 2021, conducted wet labs for PG as a part of pivot programs, Glaucoma Conference 2025, published 15 papers in national and international journals. Over to you, madam.
Thank you for the kind introduction, ma'am. So, shall we start the rapid fire round now?
So, now teams will log in. Okay, the first team which will play the rapid fire round is Team Retinals from AIMS Raipur. Are you there?
Yes, ma'am.
Okay. So please switch on your audios and videos.
Yes, ma'am.
So, please introduce
So from-
yourself.
Ma'am, I am Dr. Arushi from AIMS Raipur. I'm Dr. Aisha from AIMS Raipur.
Welcome to the quiz. I wish you all the best.
Yes, ma'am.
Uh,
Thank you, ma'am.
Shall we start, ma'am?
Yes.
Yes, ma'am.
So, your time starts now. What is the mechanism of congenital glaucoma?
Uh,
You choose fast. Brooks membrane has how many layers?
5 layers.
Cave ring in Wilson's disease is present in 100% of patients with what clinical manifestations?
Pass. Care pleasure ring.
What is the other name of retrolental space?
Burger space.
Recombinant cytokine with anti-proliferative, antiviral, immunomodulatory properties used in OSSN.
Mitomycin.
Sorry.
Interferon. Interferon.
Interferon, you should be specific. Which one?
Interferon alpha.
Wrong. So the answers are, you got only the second question right. 5 layers.
Fourth
It's,
one.
Burger space.
Burger
Burger
space.
space.
Burger
Burger
space.
space, yes. Two questions. Sorry. Fifth question, you told alpha. To be specific, alpha 2b it was. Fifth question.
You want
So-
me to deduct the marks or what? Or
So they were partially right, ma'am. You can give half if it is possible.
okay.
So quickly to say the answers. What is the mechanism of congenital glaucoma? Developmental abnormality of the trabecular meshwork. Brooks membrane has 5 layers. They answered. KF ring in Wilson's disease is present in 100% of patients with neurological involvement. So other name of retrolental space was Burger space. Recombinant cytokine was interferon alpha 2b. Well played. The next team now.
Plus 25 to them from
I
this.
get 25 marks. Yes, ma'am.
So the next team is Team I Conquer from IGMC Pondicherry. Are you there?
Ma'am.
Yes.
Welcome to the team I Conquer. Please introduce yourself.
I'm Dr. Ashwini from Pondicherry GH. Dr. Lakshya from Pondicherry GH.
Wish you all the best. Can we take the rapid fire? What is the mechanism of pupillary block glaucoma?
From PC to AC, the iris aqueous flow will be reduced.
Okay.
Deposition of gold in cornea is called as. Be fast. Say pass. Which extraocular muscle has longest course?
Superior rectus. Superior rectus.
Choroid has 2 firm attachments to its sclera. One is at the optic nerve head and the other is at.
Time is up. You can answer the fifth question, but you will not get the marks.
Yes. Team I Conquer.
Sodium hyaluronate.
Okay. So let's see the answers.
So they got the first answer right. Others all one answer wrong.
Yes, the
So
plus
minus 5. Plus 10 minus 5, it's 5.
Ma'am, you can answer. I mean, just discuss the questions.
Sorry. So mechanism of pupillary block glaucoma is the resistance to aqueous flow from the posterior to anterior chamber. Deposition of gold in cornea is called as chrysiasis. Extraocular muscle, which has the longest course, is superior oblique, not superior rectus. Choroid has two firm attachments at the sclera. One is at the optic nerve head, the other is at the vertex veins. So this is more important because it restricts the choroidal detachments. When choroidal detachments happen, it is the demarcation. Beyond that, the choroidal detachment doesn't happen. What are the components of viscoat or hyalot ocular viscoat elastic device preparation? That is chondroitin sulfate and sodium hyaluronate. You answered only sodium hyaluronate, but it also includes chondroitin sulfate. So they get one answer right and one answer wrong.
Plus 5.
So the team 3.
Team 3 is Team Phoenix Petals from Sankara Eye Hospital, Coimbatore. Are you there?
Yes, ma'am.
Welcome to the team Phoenix Petals. Introduce yourself, ma'am.
Good evening. We are Team Phoenix Petals from Sankarai Hospital, Coimbatore. I'm Dr. Suprita. Today, my colleague is not able to join the quiz, so I'll be playing alone.
So wish you all the best. Can
Thank
we take
you.
the questions? What causes IOP rise in pseudoexfoliation glaucoma?
Trabecular meshwork block.
Which lenticular condition can mimic corneal blood staining?
Pass.
How many corneal positions of gaze are there?
9.
Intravitreal injection is administered at what distance from limbus to in phakic adults?
4 mm.
Gene mutation that results in anomalies like coloboma petrus anomalies.
Pass.
So can we take the answers? So deposition of pseudo exfoliation material was the specific answer, but we will give it to you because you meant the same. Which lenticular condition can mimic corneal blood staining is the anteriorly dislocated lens. So there are 6 cardinal positions only, not 9.
Okay.
Uh, intravitreal injection is administered at 4 mm. You said it right. Gene mutation was PAC6. Coloboma Peters anomaly, it is PAC6. So one right answer and one wrong answer, ma'am. Two right answers.
Two right and
answers,
one wrong.
one
So
wrong.
plus
Yes.
Plus 15, no?
yes, two right
Yes.
and one wrong. So plus
Yes.
15.
Okay.
So the next team is Team Icon from NSCB Medical College, Jabalpur.
Welcome to the team. Please introduce yourself.
Yes,
Team
yes,
Icon,
I'm
please
Dr. Harsha
introduce
Singh.
yourself.
Yes, I'm Dr. Harsha Singh from NSCB, Jabalpur.
So you're playing alone today?
Yes, my partner has not come from the DRP yet.
Okay. Be
Okay.
closer to
All
the
the
mic.
best.
We can't hear you.
Hello.
Be closer to the mic.
Okay.
Else we will not be able to hear you, your answers.
Please be louder.
Hello. Okay. Yeah.
Please. Okay. Media will play. Be louder and say pass if you're not able to answer the question so that you can take all the 5 questions. Can we
Yes, ma'am.
start now?
Okay.
What is the mechanism of pigmentary glaucoma?
Blocking of trabecular meshwork.
What is the pathogenesis?
Sorry,
What
sorry.
is the so we'll restart.
Okay.
What is the mechanism of pigmentary glaucoma?
Blocking of the trabecular meshwork.
What is the pathogenesis of infectious crystalline keratopathy?
Pass.
In levodepression, what is the yoke muscle of the left inferior rectus?
Right SO.
Cells of Roget surrounded the capillaries are called as.
Pass.
What is the first line of treatment in aggressive ROP in zone 1?
Intravitreal injection.
Okay. So she has answered
3 correct.
yes. Plus 30.
Yes.
what mechanism of pigmentary glaucoma was trabecular blockage by iris pigment that you should have been specific, but we will give it to you. What is the pathogenesis of infectious crystalline keratopathies? Microbial colonization and biofilm formation. In levodepression, the yolk muscle of left inferior rectus was right supraoblique, you are right. Cells of Roget surrounded the capillaries are called as pericytes. First line of treatment is anti-VEGF. You have told it right. Good, good job.
So the next team is Team Vision Walkers from Basaveshwar Medical College, Gulbarga.
Welcome to the team. Vision Walkers, is it?
Vision Walkers.
Yes. Welcome to the team. Please introduce yourself. You please unmute yourself.
Can you listen to us, ma'am?
Yes, yes. You're audible. Please introduce yourself.
Yes, ma'am. Myself, Dr. Anaga from MR Medical College, Kalburgi, ma'am.
I am Dr. Pranit from MR Medical College, Kalburgi, ma'am.
Wish you all the best.
Thank you.
Shall we start? So, accumulation of this material causes reduced trabecular outflow in steroid-induced glaucoma.
Sodium hyaluronic acid.
Common causative organism of crystalline keratopathy. In Bagolini striated glasses, what is the angulation of striations in each of the glasses of trial frame?
60 degrees.
Cholinergic supersensitivity is a feature of which pupillary abnormality?
Pass.
Last question you can take, but no marks. The stage of macular hole with complete separation of posterior cortical vitreous from the edges of macular hole and the optic disc is called which stage?
Stage 3, ma'am.
Wrong. It's stage 4. Can we take the answers? The first one was extracellular matrix glycosaminoglycans. You answered it as sodium hyalinate. Common causative organism is Streptococcus viridans. In Bagoli striated glasses, the degrees are 45 and 135 degrees. The cholinergic supersensitivity is a feature of AD's pupil and it is a stage 4. The macular hole with complete separation of posterior cortical vitreous from the edges of the macular hole is stage 4. So
The
they have answered
2, but both were wrong.
Both were wrong. -10.
-10. Okay.
Sorry, better like next time. Next rapid fire round is there. Don't worry.
Yes, ma'am.
So I would like to introduce Dr. Mahati. I'm happy to introduce her. She was my colleague, friend, senior from Shankarai Hospital. She did her MBBS from PS Medical College, Kupam. She's finished her MS Ophthalmology from AMC, Vizag. She is a fellow in pediatric ophthalmology and strabismus from Shankarai Hospital, Guntur. She is currently working as a consultant and head department of pediatric ophthalmology and strabismus at Shankarai Hospital, Guntur. Her areas of interest are oblique muscle surgeries, myopia control strategies. I welcome you, Dr. Mahati, and please take over.
Thank you, Dr. Shruti. Thank you for the kind introduction. I hope the next team is ready.
So team 6 is Team Visionaries from KMC Mangalore.
Is the team ready?
Yes, ma'am, we are there.
Okay.
I'm Dr. Pallavi.
I'm Dr. Anaga from KMC Mangalore.
Team Vision Walkers, please switch off your video. Vision Walkers, you are finished. Please switch off your video. Vision Walkers. Yes. Team Visionaries, welcome. Shall we start?
Yes, ma'am.
Okay.
Yes.
So we are
Time starts now.
timer.
What is the most important root cause of glaucoma and IC syndrome?
Pulling up the angle because of
Secondary
the
angle
second
closure.
one.
Secondary angle closure.
Type of laser used to treat recurrent corneal erosions?
Pass.
What is angle kappa?
Between the visual axis and the pupillary axis. Sorry, axis.
Fetal pupillary membrane is attached to which portion of the iris?
Collarettes.
You can answer the last question, but you will not get the marks.
Okay.
The syndrome characterized with the presence of rheumatogenic RD and high IOP. Shilpi ma'am, don't display the answer. What was your first answer?
Secondary angle closure.
And the pulling of
Previously you said something else.
No, for the first question, we answered secondary angle closure.
Before that also you mentioned something else.
Yeah, I was trying to explain the mechanism, but till then she said the secondary angle closure.
What? That what we are expecting from you.
Okay. Ma'am, because the angle, there is a pull at the angle which is causing the angle to close secondarily because of the fibrosis, basically.
Okay.
Okay.
Shall I reveal the answers
Okay,
now?
let's see the answers. The most important cause of glaucoma and IC syndrome is membrane over the angle structures.
We can
Dr. Shruti will be there.
Dr. Shruti, can we give?
Dr. Shruti? We can't hear you. Please unmute Dr. Shruti.
Yes, we can give Dr. Marti. Secondary angle closure is the right
Okay.
answer.
Okay. The second question, the laser used is phototherapeutic keratectomy. They didn't get that. The third answer, what is angle kappa? What was your answer? It is between visual axis and
pupillary axis, yeah.
They answered right.
Yeah.
Right. The fourth question is answer is colorate.
Yeah.
And the fifth question, the answer is Schwarz-Matsua syndrome. So they got
3 correct.
3 right.
Yes. So plus 30.
30.
Okay.
Plus
Thank you,
30.
ma'am.
Thank you.
So the next team in line is Team Pulse Points from Arvind Eye Hospital, Coimbatore.
Welcome, Team Pulse Points. Please introduce yourself.
Ma'am, I am Dr. Kajol. I am Dr. Deep Sikha from Arvind Eye Hospital, Coimbatore.
Yes. Are you ready?
Yes, ma'am.
Yes, your time starts now. Treatment of mild to moderate diffuse lamellar keratitis after LASIK.
Pass.
In the presence of which artery, a case of acute central retinal artery occlusion can have a best corrected visual acuity of 6.6.
Sparing of the retinal artery.
The lens fibers formed after birth until puberty forms which part of the lens?
Pass.
Which glial cell predominates anterior to lamina cribrosa? Okay, time's up, but you can try the last question. On which part of the trabecular meshwork is the aiming of laser beam focused on? If you don't know, please say pass. Okay. Don't want to try this? Okay. Okay, ma'am, please display the answers.
You were saying something?
No.
Okay.
So, treatment of mild to moderate diffuse lamellar keratitis after LASIK is topical steroids. In the presence of which artery, you got that right, is ciliaretinal artery supplying fovea. The lens fibers formed from birth until puberty forms the nucleus. And the glial cells which predominate anterior to the lamina cribrosa are the astrocytes. And on which part of the trabecular meshwork is the aiming of laser beam focused on? It is at the junction of pigmented and non-pigmented trabecular meshwork. So they got 1 right.
Plus 10 to them.
Yes. Plus 10.
Okay. So the next team is Team High on Eye from AIMS, Bhubaneswar.
Yes,
Hello.
please introduce yourself.
Hi, ma'am. I'm Dr. Lasya from AIMS Bhubaneswar, and my teammate couldn't make it today, so I'll be playing alone.
Yes, all the best. So your time starts now. Which laser is used to treat mild epithelial ingrowth after LASIK?
Pass.
What is angle gamma?
Pass.
Which systemic anti-glaucoma medication is contraindicated in patients with sulfa allergy?
Pass.
In phototransduction, which enzyme acts on CGMP to result in hyperpolarization?
Pass.
What is excitation wavelength used in fluorescent angiography?
Pass.
Answers, please. So the laser used to treat mild epithelial ingrowth after LASIK is the NDR laser. Angle gamma is angle between optical axis and fixation axis at the center of rotation of the eyeball. The anti-glaucoma medication, which is contraindicated in patients with sulfa allergy, is acetazolamide. The enzyme which acts on CGMP resulting in hyperpolarization is a phosphodiesterase. And the excitation wavelength used in fluorescent angiography is blue excitation filter between 465 to 490 nanometers. It's okay.
All the questions. So no marks from this round.
No marks.
The next team is this Vision Savers team from Government Hospital Madurai.
Is the team there?
They have joined basically. Vision Savers, are you there? Okay. Let's move to the next team. Team Ascent from Shankara Netralaya, Chennai. Team Ascent from Shankara Netralaya, Chennai.
Yes, ma'am. Ready.
Okay.
Please introduce yourself.
I am Ma'am Dr. Hussain from Shankar Nethralaya, third year, final year PG.
I am Dr. Jay from same institute, ma'am, Shankar Nethralaya, Chennai.
All the best. Your time starts now. Ma'am, questions?
Sorry, sir. We'll give you extra time.
Bleeding on attempted removal of the conjunctival membrane indicates which type of conjunctivitis?
Pseudomembranous conjunctivitis.
In patients with inferior oblique overaction, which type of pattern squint is seen?
Ma'am, V pattern.
V pattern.
Double hump sign on
Plateau iris.
gonioscopy is
Plateau iris.
pathognomonic.
Plateau iris.
Which specific bone forms the roof of optic canal?
Pass.
How many disc areas of non-perfusion on standard FFA is classified as ischemic central retinal vein occlusion?
Ma'am, 2.
Okay.
Yes. Okay. The first answers, ma'am.
10.
It is true membranous conjunctivitis. If there is bleeding, it is true membranous. You got it wrong. It is -5. V pattern, you got it right. Plateau iris, you got it right. The roof of the optic canal is formed by lesser wing of sphenoid, and it is more than 10 disc areas of non-perfusion. So you got 2 wrong, 2 right. So that will be 10 marks.
Yeah. I think team Vision Savers, team Dr. Siva team, you have joined. If you're facing any problem, please raise the hand. Okay. Let's move on to the other team. Team Iris from Comtrust Eye Hospital, Kerala.
Good morning, good evening, madam.
Good evening.
Yes, please introduce yourself.
Yes. I'm Dr. Vaishna. I'm Dr. Sumaya from Comtrust Eye Hospital. We are from Comtrust Eye Hospital.
Yes, all the best.
Thank you, madam.
Your time starts now. Role of ascorbate in chemical injury of the eye?
To promote epithelialization. As vitamin C
Which type of spectacle should be prescribed for correction of high AC by ratio?
Plus lenses. Bifocal lenses.
What type? Which cells are
lenses.
primarily targeted for a selective laser trabeculoplasty?
Between pigmented and non-pigmented trabeculoplasty.
Name the structure passing through the optic canal along with optic nerve and ophthalmic artery.
6 nerve.
ILM drape sign on OCT is seen in which condition? We are not going to give you this, but still.
Oh my goodness. No idea.
I want to ask the second answer.
Bifocals, madam. Accumulative esotropia.
Specific.
You have to be specific.
5 plus lenses. Lenses, madam.
Yeah, plus lenses. What type of bifocals?
What type of bifocals you use for these?
high AC by ratio.
Executive type.
Okay. And
Yes.
first answer?
Fourth, madam.
First one.
First one. Ma'am, as vitamin C promotes epithelialization, collagen formation, and thus promoting the epithelial growth.
The third answer?
Between pigmented and non-pigmented trabecular meshwork.
Madam, they didn't get it right, ma'am. They
Yeah.
didn't get them right.
Yes.
So the first is the new collagen synthesis. They are called executive bifocals in a high AC by ratio. The cells primarily target are the trabecular meshwork melanocytes, and the structure passing through the optic canal is sympathetic plexus. Ileprepsine on OCT is seen in macular telangiectasia.
So 2 correct.
So they got 2 wrong.
And 2 correct. So it is plus 10.
10 plus 10.
So we are over with one set of MCQs and 2 sets of rapid fire round. So now it's time again. It's time for a commercial break. So we thank the His Highness team for all the support throughout the season. So this is a small break ad from their end. So please mark your calendar. Our next quarterfinal, that is quarterfinal 3, will be on 8th of April with new quizmasters at same time on Wednesday. So now I again invite Dr. Neha Desai to conduct the second round of MCQ round. MCQ.
Yes, madam. So, question number 1 is a 7-year-old child complained that she cannot see anything on whiteboard clearly. On ophthalmological examination, she is found to have 2 millimeter shortening of axial length of the eyeball. How much eye power will this lead to? Options are A. 3 diopter myopia, B. 6 diopter myopia, C. 3 diopter hypermetropia, D. 6 diopter hypermetropia. Your time starts now. And the answer is D. 6 diopter hypermetropia. Shortening of 2 millimeter of axial length of eyeball will lead to 6 diopter of hypermetropia. In axial hypermetropia, 1 mm shortening of anterior-posterior diameter of eye results in 3 diopter of hypermetropia. Therefore, 2 mm shortening will lead to 6 diopter of hypermetropia. In curvatural hypermetropia, 1 millimeter increase in radius of curvature results in 6 diopter of hypermetropia. The next question is, a lesion at the optic chiasma typically produces options A. Homonymous hemianopia, option B. Bitemporal hemianopia, C. Central scotoma, D. Binasal hemianopia. Your time starts now. And the answer is B. Bitemporal hemianopia. Because the chiasmal compression causes the damage of crossing the nasal fibers. The next question is, smile surgery primarily corrects refractive error by modifying option A. Corneal epithelium, B. Corneal stroma, C. Lens curvature, D. Axial length. Your time starts now. And the correct answer is option B, corneal stroma. The SMILE means small incision lenticule extraction. The femtosecond laser create a small lenticule inside the stroma and it is removed from the 2 mm corneal incision. The next question is, Vogt-Koyanagi-Harada's disease is associated with option A, HLA-A3, option B, HLA-DR4, C, HLA-B27, D, HLA-B51. Your time starts now. And the correct answer is B, HLA-DR4. BKH disease is bilateral granulomatous panuveitis. There is an association with HLA-DR1 and HLA-DR4. The next question is, based solely on the image above, which of the following complication is most likely? Option A, anterior subcapsular cataract. B, secondary angle closure glaucoma. C, corneal endothelial decompensation. D, retinal detachment. Your time starts now. And the answer is B, secondary angle closure glaucoma. The image shows posterior chamber phakic IOL, where the central portion of the lens moves anteriorly, pushing the iris forward. So, excessive vault narrows the anterior chamber angle, predisposing to secondary angle closure glaucoma.
Thank you, ma'am. So, Dr. Shruti, I invite you again for the second sets of rapid fire round.
Yes, ma'am. Next team will be?
So, the next team is, I think, Team Vision Savers.
Yes, ma'am.
Yes, welcome to the quiz. Please introduce yourself.
I'm Dr. Preeti from Madurai Medical College, ma'am. Dr. Sivashankar from Madurai Medical College.
We can't hear you properly.
Your voice is not audible.
Sivashankari from Madurai Medical College, ma'am. Preeti
Okay.
from Madurai Medical College, ma'am.
Please be closer to the mic and say pass if you don't get the answer so that you can attempt all the questions. Can we have the questions, ma'am? In hereditary cataracts, which is the most common mode of transmission? Which distinguishing property of Vogt striae helps differentiate them from the other corneal striae?
It disappears on compression, ma'am.
In which condition is restriction in elevation a hallmark feature?
Restrictive myopathy.
Which is the most common complication of laser iridotomy? What is the diameter of central subfield of early treatment of diabetic retinopathy study grid?
Pass.
Okay, they got only the second question right, ma'am.
Yes.
Answers. In hereditary cataracts, autosomal dominant is the most common mode of transmission. Distinguishing property are the stress lines which disappears on pressure. They answered it right. So they answered restrictive myopathy. Dr. Mahdi, can we give that or Brown syndrome is the right answer? A restrictive myopathy is a generalized this thing.
No, we cannot give that.
Okay. What is the -5 then? What is the most common complication of laser iridotomy? It's a transient IOP spike is the most common. So the diameter of the central subfield is 1 mm for the early treatment of diabetic retinopathy study. So this team gets 1 right and 1 wrong.
+5.
So +5. Yes. Thank you, Team Vision Savers. The next team will be, ma'am.
BMC 1 from Bundelkhand Medical College, Sagar.
Team BMC 1, are you ready? Please unmute yourself.
Yes,
So please
ma'am.
introduce yourself.
Good evening, ma'am. Myself, Dr. Itisha Ghia. I'm Dr. Niyati from Bundelkhand Medical College, Sagar, Madhya Pradesh.
Welcome to the quiz.
Thank you.
Are you ready? Yes. The true exfoliation of lens capsule is a feature of which kind of cataract?
Pass.
Orientation of Hertz ray in glaucoma.
Horizontal.
If a patient has isolated right medial rectus palsy, what is the direction of face turn?
Left.
On what part of iris is the aiming laser beam
Peripheral
focused?
iris.
Isoexpansile concentration of
12 to
CFX.
14%.
Correct.
Want to attempt the
Can I
first
have one question?
Glass blower cataract.
Yes. Can we have the answers? First question, glass blows cataract, they have answered. Right. Horizontal orientation, correct. Left face turn, correct. On what part of the iris of the aiming laser beam? You said peripheral iris. You should have told iris crypt. I cannot give it. Isoexpansile concentration 12 to 14%. We can give that. Plus 4 right and 1 wrong, ma'am.
It's plus
35.
35.
Yes. Good show.
Good.
All the best.
Next
Next team, ma'am.
The next team is Team Lumin Eyes from Vaidehi Medical College, Bangalore.
Lumen Eyes, are you ready? Please unmute your audio and video. Vaidehi Medical College. Are you there?
Okay, we move on to the next team. That is Team Foveal Focus from Yenapoya Medical College.
Foveal Focus. Welcome to the quiz. Please introduce yourself.
Good evening, ma'am. I'm Dr. Sarah and I'm Dr. Azna from Yenapoya.
Okay. Welcome to the quiz. Yeah, we'll have the questions now. All the best. What does presence of osseous ring on the lens indicate?
Trauma.
Hudson-Stanley line is most visible in which zone of the cornea?
Epithelium.
Which instrument is used to measure the amount of face turn?
Pass.
Which antimetabolite is most commonly used? What percentage of SF6 is used while performing pneumatic retinopexy?
Pass. Pass.
Want to attempt any other questions? Okay, time up. So answers. So the presence of osseous ring indicates trauma. We'll give that plus 10. Hudson-Stanley line, which zone I asked? It is on epithelium, correct, but interpalpebral zone you should have answered. We cannot give that. Instrument used to measure amount of face turn is goniometer. Antimetabolized used in trabeculectomy, metamycin C, you answered it right. The fifth one you didn't answer. So 2 right and 1 wrong, ma'am.
Plus 15.
Plus 15. Yes.
Thank you, ma'am. Thank you.
Good. Well played. All the best for the next.
Thank you.
Team Lumin Eyes, are you there? Sai, can you just connect with them? Because initially they were there. The next team is Team Fatforge from Chaitanya Eye Hospital, Trivandrum.
Are you there? Chaitanya Eye Hospital, Trivandrum. Please unmute your audio and video, please.
Are you there?
They are not there, I guess.
They all have joined. I don't know. Okay, the next team is Team Iconic from AIMS, Nagpur.
Yes, ma'am.
Iconic.
Yes.
Please unmute your video. Yeah. Please introduce yourself.
Ma'am, I'm Dr. Lavina from AIMS Nagpur. My teammate is unable to participate, so I'll be performing myself.
I wish you all the best. Can we have the questions now? Which test helps differentiate the pseudo-pterygium from the true pterygium?
The probe test.
Correct. Premature localized whitening of hair of eyelashes and eyebrows is called.
Metarosis. Poliosis.
What is the mechanism of action of mitomycin C in trabeculectomy?
It's an anti-sclerotic agent.
Name the axillary lacrimal glands found in the fornices.
Pass.
What is the laser spot magnification of the contact lens which induces an image magnification of 0.5 times, 0.5x?
Pass.
Okay, can we have the answers? The first answer was probing test, which will differentiate pseudotergium from pseudotergium. She answered it right. Poliosis, she answered wrong first and then corrected herself. Can we give, ma'am?
Yes.
Yes. So the third question, she told anti-sclerotic, the mechanism of action of mitomycin C, we cannot give. At least she should have told anti-fibrinolytic. Inhibits fibroblast proliferation by cross-linking DNA. So that we can't give. Name the axillary lacrimal glands. Crozet, she didn't answer. The fifth one is laser spot magnification is 2 times for the contact lens, which is 0.5x. So 2 right and 1 wrong. Plus 15.
So the next team in line is Team Elite I League from ACPM Medical College, Dhule.
Welcome to the rapid fire round. Team Elite I League, can you please introduce yourself?
Yes, ma'am. I'm Dr. Savni from ACPM Dhule.
And I'm Dr. Abhishek Goenka from ACPM Medical College, Dhule.
All the best. Can we have the questions? Minimally invasive, high precision surgical procedure that uses a laser to create precise intrastromal corneal pockets or tunnels for pigment. Cogan's lid switch sign is seen in. What is the usual concentration of mitomycin C used in trabeculectomy?
Pass.
Attachment of basal cells of the corneal epithelium to the basal lamina is by
Desmosomes.
the wavelength of frequency doubled NDR laser used for panretinal photocoagulation.
1064 nanometers.
So the answers, can we have the answers? Answer is femtosecond assisted laser. The first one, the minimally invasive high precision surgical procedure that uses laser to create the precise intrastromal corneal pockets is FLAC, that is femtosecond assisted keratopigmentation. Cogan's slit sign is seen in ocular myasthenia. So the usual concentration of mitomycin C is 0.02 to 0.04%. The attachment of basal cell is hemidesmosomes. They answered it as desmosomes. We can give it, I guess. The wavelength of frequency doubled NDR laser, they answered it wrong. It is 532 nanometer. 1 right and 1 wrong.
2 right and 1 wrong.
Ocular myasthenia, they answered, is it?
Yes.
Yes.
Yes. Oh, yes.
Plus 15 then.
Plus
Yes.
15 to 10. Yeah.
Yes, yes.
Thank you.
Thank you.
Team Fact Force, are you there? Okay. Dr. Mahathi?
Yes, ma'am.
So, shall we start?
Yes, ma'am. Yes, ma'am. The team is ready, ma'am. I can't find the teams there.
Are we done with the Teen Luminize? No, they didn't answer, no? Teen Luminize? If you are there, you can hear us, just raise your hand. Team Fact Forge, because both the teams have joined initially. So that's why I'm repeatedly asking them. Team Luminize and Team Fact Forge. If you can hear us, just message us or raise the hand. The next team in line is Team Iconics from PGIMS Rohtak.
Yes, Team Iconic, are you ready?
Yes,
ma'am.
Please introduce yourself.
Ma'am, I'm Dr. Kritika from PGIMS Rohtak, ma'am.
And myself, Dr. Payal from PGMS Rohtak.
So you are ready?
Yes, ma'am.
All the best. Your time starts now. Which topical drops are used to dissolve filaments in filamentary keratitis? I can't hear you. Pass if you don't know.
Pass, ma'am. Ma'am,
What
pass.
is
My
the
first
thinnest
question, pass, ma'am.
What is the thinnest wall of the orbit?
Pass, ma'am.
Most serious sight-threatening complication associated with MMCUs?
Pass.
Outer BRB is composed of fenestrated endothelium of choriocapillaries, RPEs, and what else?
Pass, ma'am.
Okay, next. Macular ischemia is diagnosed on angiography based on which finding? You'll not get this, but you can try.
Enlarged foveal avascular zone.
You answered only one question and that too after the time.
Out of time.
We are continuously asking everyone, if you don't know the answer, you have wasted your 17 seconds on the first question only.
If you don't know, please say pass. So the first one is the topical drops used for filamentary keratitis is acetylcysteine. The medial wall is the thinnest wall of the orbit, which is called lamina papricia. Bleb-related endophthalmitis is the most severe sight-threatening complication of MMCUs. Outer blood-retinal barrier is composed of the fenestrated endothelium of the choriocapillaries, RPE, and Bruch's membrane. Yes, you got the last one right, but we cannot give you. It's okay. All the best.
Thank you.
The next team, please.
Team Dreamers from Veer Surendra Sai Institute of Medical Sciences and Research, Sambalpur, Odisha.
Yes, Team Dreamers. Switch on your video.
Yes, ma'am.
Yes, please introduce yourself.
Myself, Dr. Pragya from Bhimsar Burla.
Myself, Dr. Mohesh from Bhimsar Burla.
So you are ready?
Yes, ma'am.
If you don't know, please say pass. Time started. Subconjunctival bevacizumab is used in which corneal condition?
Pass.
On radiology, what is the pathognomonic feature of thyroid involvement of extraocular muscles?
Coca-Cola bottle sign.
What is the primary site of resistance to aqueous flow?
Pass.
If you don't, the group of fiber tracts that control horizontal eye movements by interconnecting oculomotor and optic nerve nucleus and brainstem is
PPRF and MLF.
First one is corneal neovascularis.
Sorry, we cannot give you. Name the vitamins which are a part of RH2 supplement. You can try that.
Vitamin C.
Vitamin E.
First one, what you want?
Shilpi ma'am, what was your answer for the first one? Subconjunctival bevacizumab.
Corneal neovascularization.
Yes.
We can't
They
give
got
you
it
the last
right,
one.
but it was way out of time, ma'am.
Yes, that's what I'm saying. The last one we cannot give them.
Mm.
Okay, that's
No,
why
the first answer.
everyone, just be fast because you know the answer, but just because of the time, you are not getting.
And questions are also lengthy, na ma'am.
That is the trick. That is the point, no? Ma'am,
That's why
answers,
we
ma'am.
yes, and that's why we are just displaying all the questions together.
Ma'am is
Uh,
kindly consider, ma'am.
rules are rules. Rules are for same for everyone.
First one we will consider for you, but not the last one.
Okay, ma'am.
First one will be done. The second one you got it wrong. It is the sparing of the tendons. The third, no. The fourth also, you said all
Coca-Cola
the
bottle
tracks.
sign is second one. We said Coca-Cola bottle sign means
Sparing of the tendons.
Yes, okay. Yes, that Coca-Cola bottles the sign is right. The fourth one, you said what are all the fiber tracks are present, everything you said.
MLF,
That we
PPRF
can't
both
give you.
said, ma'am.
And you said MLF after time. So we cannot give you that. So we are giving you the first two.
We can consider the fourth one, but not the last.
Fourth one, huh?
Okay.
Thank you, ma'am.
Okay.
Fourth one will be full or half, ma'am?
I think we didn't answer the first question the first time. They said pass.
But
yeah, they answered it the last.
Yes, they answer in the last. Yes.
Okay.
Okay. So 3 correct and 2 pass, so it will be plus 30 to them.
30. Yes.
So the next team is any team remaining? Team Optic Nerds, are you there? Team Funders Frontiers, are you there? Team Fact Forge, are you there? Team Luminize, are you there? Okay, we will start with the next MCQ round. If any of these teams will join, we can take the rapid fire round after the MCQ round.
Okay, ma'am.
Dr. Neha?
Yes, ma'am. Question 1 is a 20 years old female has progressive myopia and irregular astigmatism. Scissoring reflex noted on retinoscopy. Most sensitive diagnostic test is option A, keratometry, B, refraction, C, pachymetry, D, topography. Your time starts now. And the answer is D, topography. Corneal topography is a non-invasive imaging technique. It helps in detailed mapping of corneal curvature and early diagnosis of keratoconus and follow-up for progression. The next question is, in blowout fracture, enophthalmos occurs due to option A, orbital hemorrhage, B, muscle fibrosis, C, increase in orbital volume, D, decrease in orbital fat. Your time starts now. And the answer is C, increase in orbital volume. Orbital floor fracture increases the orbit volume leading to enophthalmos. The next question is, painful ophthalmoplegia with involvement of third, fourth, fifth, and sixth nerve is mostly suggestive of option A, Tolosa-Hunt syndrome, B, myasthenia gravis, C, multiple sclerosis, and D, thyroid eye disease. Your time starts now. And the correct answer is option A, Tolosa-Hunt syndrome. Tolosa-Hunt syndrome is a painful granulomatous inflammation of cavernous sinus causing multiple cranial nerve pulses. The next question is, a 50-year-old male patient presented with history of blunt trauma. Which complication is most characteristic of retinal detachment associated with this tear? Option A, macular hole formation, B, proliferative vitreoretinopathy, C, central retinal vein occlusion, D, choroidal melanoma. Your time starts now. And the answer is option B, proliferative vitreoretinopathy. The image shown was of giant retinal tear. So giant retinal tear have a high risk of proliferative vitreoretinopathy due to large exposed retinal pigment epithelial cells and inflammation. The next question is, which investigation is most sensitive for detecting early hydroxychloroquine retinal toxicity? Option A, fundus fluorescein angiography. B, visual acuity testing. C, multifocal ERG. D, B scan ultrasonography. Your time starts now. And the correct answer is option C, multifocal ERG. Because the early hydroxychloroquine toxicity affects the parafoveal photoreceptor, so that can be detected with the ERG.
So with this, we end with the MCQ round. Any team which is remaining, because I can see Team Factforce is already there, but they didn't play the rapid fire round. Any of the team who is there present on the Zoom and rapid fire round is not played with them?
Ma'am, Fact Forge is also there, ma'am. They have also not
They
played.
are not answering. They are not answering to the calls. They are not answering.
Okay.
That's the only reason.
Hmm.
Any of the team which is remaining? Okay. So now, okay then.
So thank you, everyone. Thank you. It was a great quiz. Thank you, all the three quiz masters, for taking us through all these wonderful questions. And in fact, it was quite challenging even to us. I thought I've gone by. I started scratching my head, and then I laid down my arms, accepting that I'm about to retire. I better retire from ophthalmology. But very well drafted, very well crafted questions, Dr. Neha, Dr. Shruti, and Dr. Mati, and all for and sincere most thanks for all the efforts. So, friends, so all the postgraduates, all the participants, we will be announcing the results at the conclusion of all the four quarterfinal results. And remember, following that, there are two more quarterfinals left. Yeah, two more quarterfinals left. So the third one will be on the coming Wednesday. That is going to be the 8th of April. And then following one would be the last one would be on the 15th of April. Okay, so be ready that we will have next set of teams. But for people who have participated in the previous or now, who were participant, they would not be eligible to participate as a team, but they can participate in a practitioner category so that they can win through the prizes which are meant for private practitioner category, as well as it would be a learning process for them how it is conducted. So here we are having the people from the private practitioner category who are into the top 5 and who are eligible for the prizes for per episode. So the numbers are on the screen: 70097499784. That is AAD. Then we have Q. He's another repeated finalist among the practitioner category. Then 982350. So whoever's number is depicted over here are into they have won the prizes in the private practitioner category. We request you to raise the hand so that we can promote you as a panelist, and you can join us for a chat with the quiz masters for a short while before we wind up the show. So can I request all these people, 7009749784, 8597993902, 9823506468, 9769300455, 9061031036. So we can unshare the screen. We are waiting for you to raise the hand so that we can promote you as a panelist, and we would like to have a small chat so that people get inspired. The audience can get inspired from all of you. Also, we might be having few of the mentors of the team who must have logged in. You can also raise the hands, ma'am. Sir and ma'ams, we would like to have a chat with the mentors who are so much committed to their teams and who are present with us, just to learn from you how you inspire your students. So any of the mentors, we request you to raise your hands. That will help us in promoting the team. Sai, can you see some of them?
I have promoted 3 of them, Doctor.
Just get your video on, the finalist. Yes. Again, this guy again from Coimbatore, he is a repeated offender. बोलो भाई क्या बताए?
Yes, sir. It's good to log in every time. Good to meet you. Good to see you.
I was looking for new faces, but this man, Mahathi and Dr. Shruti and this guy has, in fact, pockets up every time some prize money from me. And I think the place where he's working is not paying him adequately. And so he steals up the time from there and he
Fellowship
survives on
doesn't
whatever
pay
money
much.
he's making from a big queue. Hmm? I need to tell Dr. Ramamurthy's. So, Dr. Yeah, thank you once more, Parth, for joining us, and do play us and do create an awareness amongst your other DNB residents as well. Okay, thank you.
Thank you so
Congratulations.
much. Thank you, sir.
Yeah, we have Akshika Damija. So where are you? Can you just
Good
introduce?
evening, sir.
Yeah, please welcome.
Sir, I am presently working as SR at GMC Ganganagar.
At GMC?
Ganganagar.
Okay. Dr. Shruti, Dr. Mahathi, you can have a small conversation with these people. And Neha also.
So this is Dr. Shruti.
Okay.
Yeah.
Yeah, we will come to you. I will come to you.
Sorry.
We will have a small chat with Akshika and then we'll come to you. Mati and Shruti, you can have a chat with this Akshika. The quiz master, Shruti.
Dr. Akshika, tell us more about you.
Ma'am, I have done my PG from SNMC Jodhpur. Currently, I am working as SR at GMC Ganganagar, and I attend almost I try to attend every episode of Big Q. It's very informative.
Yes, yes. We get to learn from each question.
Yes, ma'am. Today, all the questions were very informative.
Yeah,
Yes.
thank you.
Dr. Shruti once was a participant. Now she has become a quiz master now.
Exactly.
She is your inspiration.
Yeah, she is right. I was also like you. Every episode I used to attend, and now
Yes,
I'm very
ma'am.
happy. And I thank Prashant sir and Shilpi ma'am for giving me an opportunity. It's very overwhelming to be a quiz master here in this platform, sir.
We're so proud, Dr. Shruti, Dr. Mahathi. All the efforts are basically taken by all the quiz masters, Dr. Neha. And in fact, it is their efforts. We only, channelize everything and get together. More than me, Dr. Shilpi works so hard to get all of you together and put it in a good format. But extremely thankful. But definitely all the efforts, you feel quite contented and satisfied when you see your own people who were participating now becoming a quiz masters. I can pat myself tonight. Definitely. Thank you, Rachna. So thank you, Dr. Lakshmi. Can we have now chat with Dr. Shruti Valate? Yeah. Shruti Valate, not the quiz master, Shruti. Yeah. So just
Good evening, sir.
can
Tell me more about you. Where are you from, ma'am?
Ma'am, I'm doing a DNB in Arvinda Hospital, Coimbatore.
Oh, nice. Yeah. Which year?
From second year.
Okay. You're interested in which fellowship now?
Not glaucoma mostly, ma'am.
Oh, wow. Welcome.
encouraging for me. And though, see, host, co-host are retina people, and in ahead of them,
Dr.
and Dr. Neha is also.
Quizmaster has inspired her.
So, Neha, कैसा है यार? अपने रेटिना की तरफ कोई देखता नहीं है. Shruti, think about us यार. Next time.
Because retina is not that rewarding.
Shruti, just pulling you. Wherever your passion is, you should pursue it, and that
Yes.
becomes your dream, and it should be your destination as well. So you should never say, probably glaucoma. Yes, I would be a glaucoma surgeon. That should be the way you should quote it, and you would
Yes.
definitely make it.
Thank
Extremely
you.
good.
All the best, Dr. Shruti. All the best.
Thank you, ma'am. Thank you, sir.
Any of the teams you want to say anything?
Yeah, I think we have some teams over there still with us. Can you get your videos on? We can have a small chat with you as well. Retinerds, this is a very strange name. Can I have a small chat with them? Team Retinerds, are you there with us?
Yes, sir.
Yeah, just get your video on. Where did you find this hunt for this name?
Sir, we have Googled and we have mixed two names, Retina and Optic Nerds. From Optic Nerds, we have taken Nerds. So Retinerds.
So probably you have an interest in retina, at least you have. Tell me at least for consolation, yes. नेहा ये क्या हो रहा है?
No answer means
Okay,
The
good.
next time we will put more retina questions so they will get more interested in retina.
Very good. Good. Where are you from, Team Retinuts?
Sir, we are from AIMS Raipur.
AIMS Raipur. Oh, good. So you must be more interested because of Ankur and all into oculoplasty and all that.
Yes, sir.
I got it. Very well. Let's see. I think it is usually the influence of the mentor which makes a difference a lot, probably. Like
Yes.
Shilpi was dragged into retina, probably inspired by me.
Yeah.
Uh,
No second thought in that.
I had to pinch her to say that. Okay, thank you, Team Retinuts. Let's move ahead. Any other team?
Nice talking to you, sir.
Any other team with us?
Phoenix Petals.
It's a strange
Team
name.
Pulse Points.
Before we wind up, because we have another 5 minutes before we can wind up, we can have some inputs from you for our quiz masters as well as for us, what we can do more for you. Team Pulse Points, get your video on. Team Phoenix Petals, why are you shying away from the screen? Come. Okay. I think we, no, I think.
They have come. Team
Okay,
Pulse
Team
Points.
Pulse Points. Just introduce yourself for shortly, in a short.
I'm Dr. Kajol.
Hmm.
I'm Dr. Deepsika from Arvind Eye Hospital, Coimbatore.
Ayo, Irvin Eye Hospital, Coimbatore is means overpowering the whole brain big Q, huh? Tell Dr. DC this is not fair. Good. You can, Dr. Shruti, Dr. Neha, you can have a chat with this multiple teams from Arvind Coimbatore.
So we are in which year?
I'm a second year resident. I'm second year primary DNB.
Okay.
Second year primary DNB resident.
Okay. So which subject you are interested in? What are your hobbies? Tell me more about non-ophthalmology part. You're not audible. Please
Your
come
voice is
closer
breaking.
to the mic.
My thesis is in glaucoma, ma'am, so I'm interested in glaucoma.
Yes. Good.
Either retina or pediatrics.
This is very unfair. I think none of the people want pediatrics or squint. Everybody's running off.
Dr. Ganesh Raman sir has.
Yes, sir. Ganesh sir is my guide.
Oh, nice. He does a lot of GAT, no? He does
Yes,
it.
sir. Yes, ma'am.
And the girl who is silent, she also wants to do glaucoma.
I'm interested in glaucoma, cornea, and retina also.
Thank you. Finally, there is some consolation at the end of the day.
There is no squint in that.
There is no squint.
Adi, at least there are 3 people, retina people. At least we got one.
At least I want half, sir. Half.
You know, Marti, when I was the PG, I was the one, I'll take any subspecialty, but not the pediatrics.
Madam, for the fact, even I also didn't like pediatrics. Vijay taught me, and finally I
Great.
But now I am into it. It's very nice, and you'll start loving it.
Of course, of course. Every specialty is in itself interesting. Once you develop a love for it, there is no upper limit to it. And I think, and if you love any subspecialty, then you can take it to any heights. That's the reason for success in respective subspecialties. So that is for all the postgraduates who are watching us. Remember, all subspecialties, irrespective of our just fooling each other. Remember, they are every subspecialty has its own charm, and every subspecialty has a space wherever you are going to practice. So don't ever decide your subspecialty, where am I going to settle, what will be the limitations. If you really have a love and passion, you will develop wherever, even if you go to the Himalaya, that. So be that the message for all of you. Okay. So I think we had a nice, wonderful session today, a very nice learning for all of us as well. All credit goes to the three quiz master, Dr. Shruti, Dr. Mahati, and Dr. Neha, for wonderfully crafting and having such an interesting questions for all graduates. Of course, to some oldies like me also, who became slightly wiser. I don't know how much I irritated, but I have become slightly wiser as well. So thank you, all of you, for making such an effort. My sincere most thanks to all the teams who participated, and of course, them proud mentors who are pushing them hard, guiding them so that they can excel in the respective in their field in this quiz as well. And my thanks also to His Highness team and Sai and his team for all these programs and all the efforts. So without much delay, now it's time to sign off. We will be meeting on following Wednesday, that is 8th of April, at the same time, that is 7:30 p.m. with third quarterfinals. Till then, bye bye from our end. Bye bye. Good night.
Thank you.
Thank you.
Good night, sir. Thank you so much.
Good night.
Right,
Thank you, sir. Thank you,
thank
Shilpi
you,
ma'am.
sir.